Hello everyone. The next developmental disturbances affecting oral and paraoral structure I'll discuss, that is dens evaginatus. These are some other names for dens evaginatus, like it is also known as central tubercle, occlusal tuberculated premolar, Leong's premolar, evaginated odontoma, and occlusal enamel pearl. The dens evaginatus is a developmental condition that appears clinically as an accessory cusp or a globule of enamel on the occlusal surface between the buccal and lingual cusp of premolars. In the picture you see there is a presence of a globule or a cusp which is present between the buccal cusp and lingual cusp of premolar. These dens evaginatus consist of enamel, dentine and pulp. It is present unilaterally or bilaterally. It has been reported to occur on molars, cuspids, that is canine, and incisors. Coming to prevalence, it is around 2.2% and it is present rare in whites, but the prevalence is as high as 15% in Asians. It normally consists of enamel, dentine and pulp, and the process rare in white. Coming to pathogenesis, the pathogenesis of the lesion is thought to be the proliferation and evagination of an area of the inner enamel epithelium and the subjacent odontogenic mesenchyme into the dental organ during early tooth development. So, it has been considered to be the antithesis of the mechanism of development of the dens indentae or dens invaginatus. It is the opposite of the pathogenesis of dens invaginatus. The clinical significance of this condition is similar to that of talon cusp and it may physically resemble. Like in the picture, it is a cusp-like elevation is present which is located in the central groove of mandibular first cuspid. This is the mandibular first premolar and there is a cusp-like elevation which is present between the buccal cusp and the lingual cusp. The extra cusp which is present in dens evaginatus contribute to incomplete eruption, displacement of teeth and or pulp exposure with subsequent infection following occlusal wear or any occlusal fracture. This phenomenon has been discussed by Senia and Regesi, who have reported periapical infection of caries-free premolars affected by dens evaginatus. Then radiographical picture. Radiographically, the occlusal surface exhibits a tuberculated appearance. In the picture you see it is a radiograph of a teeth with tuberculated occlusal anatomy. Often pulpal extension is seen in the associated cusp. Like in the picture, atresion on the accessory cusp that lead to pulpal necrosis and periapical inflammatory disease. This is the affected tooth. This is the affected tooth that showing the periapical inflammation and there is an atresion and there is a pulpal exposure. Frequently, dens evaginatus is seen with association with another variation of coronal anatomy, that is shovel shaped incisors. This alteration also occurs predominantly in Asians with a prevalence of approximately 15% in whites. Affected incisors, you can see there is a prominent lateral margins creating a hollowed lingual surface that resembles a scoop of a shovel. Typically, the thickened marginal ridges converge at the cingulum level, and it is not uncommonly in a deep pit, fissure or dens invaginatus at this junction. Maxillary central incisor and lateral incisors most frequently affected, with mandibular incisors and canines less commonly affected or reported. Then coming to the treatment plan for dens evaginatus. Dens evaginatus often result in occlusal problems and prone to fracture frequently, that resulting in pulpal exposure. Because of that, there is a pulpal necrosis, results in the cessation of root formation. So in that case, apexification with calcium hydroxide is required to achieve the closure. Sometimes extraction is occasionally recommended for non-vital teeth with an open apex in which apexification is not successful. The removal of the cusp often is indicated, but vitality should be maintained. The elimination of opposing occlusal interferences combined with gradual grinding of the tubercle and indirect pulp capping with calcium hydroxide has been suggested as the best approach when the clinician is considering removal. In some cases, pulpal removal with direct pulp capping can be done. Some investigators have protected the cusp from fracture by the placement of composite reinforcement around the projection until the root formation is complete. If shovel-shaped incisors are present, the affected teeth should be inspected for surface defects at the point where the marginal ridges converge. If there is any deep fissures or invaginations should be restored shortly after the eruption to prevent the carious exposure of the adjacent pulp. So these are all about dens evaginatus, the pathogenesis and the treatment plan in detail. So I hope you like this video. Thank you so much.